I want to tell you about something that quietly surprises a lot of people once they understand it, because it sounds backwards at first. You can do everything right for your bones and still be setting your heart up for trouble. And the supplement most people think of as completely harmless is often right at the center of it. I'm a physician who has spent years looking closely at how older adults respond to common supplements. And there's a pattern I keep running into. People come in with bone scans that look wonderful, dense, strong, exactly what you'd hope for at 60 or 70. And then I look at their arteries, and what I see doesn't match. Stiff, calcified in places they shouldn't be. And almost every time, the story is the same. They've been faithfully taking calcium and vitamin D for years, doing precisely what they were told would protect them. Here's the piece that rarely gets explained. Vitamin D's job is to open the door and let calcium into your bloodstream. It does that job well. But once calcium is circulating, it has no built-in sense of direction. It doesn't know to head for your bones. Left alone, some of it settles wherever it happens to land, and that can include the lining of your arteries and the valves of your heart. Picture a parking garage built specifically for that calcium, with plenty of open spots, sitting right there, but nobody's directing traffic, so cars just stop wherever they first find space, including the street, the driveway, the fire lane. Think of a composite of patients I've seen over the years. Call him a man in his early 70s, sharp, active, still walking 3 miles most mornings. For nearly a decade, he took calcium and vitamin D exactly as instructed. His bone density was excellent, but he started getting winded on stairs, feeling pressure in his chest with exertion. An echocardiogram showed his aortic valve had stiffened with calcium buildup to the point that it wasn't opening properly anymore. He'd done nothing wrong by the instructions he was given. He was simply missing a piece nobody had mentioned to him. That missing piece is vitamin K2. Its role is to activate 2 proteins, one that escorts calcium in a bone, and another that actively keeps calcium out of soft tissue like artery walls and heart valves. Without enough K2 in your system, those proteins stay dormant, and calcium has nothing steering it. Research following thousands of people over many years has linked higher K2 intake with meaningfully lower rates of arterial calcification and coronary disease. The challenge is that K2 is scarce in a typical Western diet. It's concentrated in fermented foods like natto and in grass-fed dairy and pastured egg yolks, none of which most people eat regularly. So when someone adds vitamin D and calcium without addressing K2, they may be increasing calcium absorption without giving the body any way to direct it safely. This is worth bringing up with your doctor, particularly if you're already taking calcium or higher dose vitamin D. K2, often in the -7 Malawian-Quatches form, is something many physicians will discuss adding alongside those supplements. There's a second piece that catches just as many people off guard, and it has to do with magnesium. Imagine buying a beautiful lamp, plugging it in, flipping the switch, and nothing happens because there's no bulb inside. Vitamin D works much the same way. What you swallow isn't active yet. Your liver and kidneys have to convert it into its usable form, and that conversion process depends on enzymes that require magnesium to function. If your magnesium is already low, and a large share of adults run low, partly because modern soil and diets simply contain less of it than they used to, adding a vitamin D supplement increases the demand on those enzymes and can pull your magnesium reserves down further. Consider another illustrative case. A retired teacher in her mid-60s started on a fairly high daily dose of vitamin D3 after testing deficient. Within a couple of weeks, she began having irregular heart flutters and painful nighttime leg cramps. She assumed she was reacting badly to the vitamin D itself. What was actually happening was that her magnesium, already borderline, was being depleted by the demands of converting all that vitamin D into its active form. And magnesium is essential for both steady heart rhythm and muscle relaxation. Once magnesium was added back in, at a well-absorbed form like magnesium glycinate, both symptoms resolved within a couple of weeks, and she was able to continue her vitamin D without further trouble. If you're on a vitamin D supplement and notice heart palpitations, cramping, anxiety, or trouble sleeping, it's worth mentioning magnesium status to your doctor rather than assuming the vitamin D itself is the problem. There's also a real difference between the two forms of vitamin D you'll find on a shelf or in a prescription. D2, or ergocalciferol, is plant-derived and is what insurers often default to because it's cheaper to produce. D3, or cholecalciferol, is the form your own skin makes from sunlight, and it's converted by your body far more efficiently and holds steady in your bloodstream much longer. Studies comparing the two consistently find D3 raises and sustains blood levels considerably better than D2 at equivalent doses. If you've been prescribed D2 and your levels aren't improving despite consistent use, that's a reasonable thing to raise with your doctor. Not something to act on unilaterally, but worth asking whether switching forms make sense for you. Timing matters more than most people realize, too. Vitamin D is fat-soluble, which means it needs dietary fat to be absorbed properly. Without it, much of the dose can pass through largely unused. Taking it with black coffee or a glass of water on an empty stomach is far less effective than taking it with breakfast alongside eggs, yogurt, a handful of nuts, or anything containing a modest amount of fat. That single change, same dose, different timing, can meaningfully improve how much actually reaches your bloodstream. Finally, there's the matter of dosage itself. The standard government guideline of around 600 to 800 IU daily was established to prevent severe deficiency diseases like rickets. It's a baseline, not necessarily an optimal target for someone trying to correct an existing deficiency. If a blood test shows you're low, the dose needed to bring levels back into a healthy range over a few months is often considerably higher than that baseline, and your physician can help you find the right number based on your actual test results, kidney function, and any medications you're taking, since the right dose really does vary person to person and shouldn't be self-prescribed at high levels without monitoring. What ties all of this together is simple. Vitamin D rarely works in isolation. It depends on K2 to direct calcium correctly, on magnesium to become biologically active, on dietary fat to be absorbed, and on adequate dosing to actually correct a deficiency rather than just maintain the status quo. None of this is reason to fear vitamin D. It remains one of the more important nutrients for bone, heart, and immune health as we age. It's simply a reason to take it thoughtfully with the right partners and with your doctor involved in the dosing decisions, especially if you're managing other health conditions or taking other medications. A short conversation at your next appointment, bringing up K2, magnesium, the D2 versus D3 question, and your actual blood levels is really all it takes to make sure the supplement you're already taking is working the way you intended it to.